Hey everyone, sorry that it's so late on getting post-op day 5 done. So as you know, we had appointments today, one of them being a follow-up to ensure that there's no infection going on, things like that. And I actually got to see the incisions for the very first time today. So first appointment, they also did a blood sugar check at that appointment, which is my weekly weigh-in, blood pressure and sugar documentation check. They did do like I said, an in-clinic blood sugar, and they were emailing my primary care, who's out on maternity leave. She'll be back literally next week. I'm actually excited to see her. And then the doctor I saw the last time, and also Dr. Allred, who's one of the other partners, to about getting me on my CGM for Dexcom. Because I showed them the 200 numbers and stuff that I've been having since surgery. And they saw in the documentation that, yeah, my blood sugars have not been behaving very well. But I did lose another pound. And I think a lot of it has to do with I'm just in a splint versus a cast boot. So after the 8th, we will have to figure out how much that cast boot weighs on top of everything, because I will be in that starting the 8th. Blood pressure was a little bit high, but of course my pain was high because I had not taken any pain medication, no Tylenol, no ibuprofen. Definitely not the pain medication, not my normal management medication. I had taken my baby aspirin, which is for the fibro in my heart. So blood pressure was a little bit high, so we're going to keep an eye on that, of course, especially here at home. Got done with that. The one appointment that we thought we had in between the appointments got canceled. And it's like, okay, well, there was that. Or it was for tomorrow or something like that. It was one of the two. I'll have to go back and look at the calendar again. But we went over to Barnes & Noble. So it's pretty much it's across the street from the hospital where I was at for my first appointment. We hung out there for a little bit, checking, the different books that are coming out, different Dungeons and Dragons, things like that, which I'm actually excited about. Don't get me wrong. We're trying to find a deaf group here to play Dungeons and Dragons. And then it got time to go to see Dr. Rowan, my surgeon. First thing that they do, as soon as we get pulled back, we had to wait for the x-ray tech to get done with another patient. They pulled me back, and then Kristen, who's Rowan's nurse, comes in and she goes, okay, let's go ahead and take off the splint and all this dressing, because it's going to be really hard to see get the x-rays properly with how much he put on day of surgery. I kid you not, I counted at least 7 ACE wraps that came off. Then, of course, the splint came off. Some of the dressing came off as well. And then we went ahead and did the imaging, the x-rays on my foot and ankle. The bone looks fine. Everything looks great that way. Screws look great. Where the tendon's at, and these type of screws that they've got there to hold the tendon in place, the bone will encase them and make it its own. He said everything looks great there. So got off the x-ray table, back into my wheelchair, went into the room. She was going to help me get from the wheelchair into the chair for the exam chair. I'm like, oh, I've got it. And, Rowan can hear me. And she's like, good girl. I'm like, not the first time I've transferred to and from wheelchairs. But anyways, went ahead, took off the rest of the dressing. Asked my partner to take pictures, and he's trying to take the pictures with his eyes closed because he doesn't want to see the incisions. So she took the phone, took the pictures that you saw, except for the one that's on the inside of the foot. I took that one because I noticed it. But as you saw, there is a ton of bruising, ton of swelling still. He came in, did a thorough check over it, how it looks and everything. And he goes, there's no infection So that's the great news. We're going to keep you in the splint for another 2 weeks. Then we'll transition you over. And he's talking about taking stitches out sometime next week. I looked at him. Aren't you out of town next week until the 8th? He goes, oh yeah, that's right. So yeah, I go back and see him on the 8th. But he said to continue doing what I'm doing, which when I'm out right now, I am staying in my wheelchair because I'm exhausted with the crutches right now. Even getting up the stairs. And thankfully, my partner had the wheelchair there. And when I got to the top of the stairs, and then just transferring to and from the vehicle to the wheelchair to the vehicle, the wheelchair to the scale and back down. Just all of that today wore me out. Coming down the stairs was another entertaining thing, but I've been resting pretty comfortably since I came home. I've only had to take 2 of the pain medication that he prescribed. When I told him that I had not taken it up until like 30 minutes prior to the appointment, and it was because I was starting to get hurt from all the transferring and the back and forth with the car and the getting bounced around. He was actually surprised. I'm like, I only took a half the night before, which is true. I took a half and then I took it, just managed it that way. So everything looks great. We were hoping that we would start talking physical therapy this appointment, which it did not happen. I'm thinking that will happen on the 8th. Sorry, my brain, I'm still trying to process all the information. He realized that I am one who is very intent, and I look at the records, I research everything, I read everything to learn, which is one reason I got into the medical field with my mom and be her medical caregiver before she passed. And like I told him, I said, you learned from the best, which is true. The doctor who did my my left ankle almost 16 years ago is will always be one of my favorite doctors. He actually retired just a few years after doing my ankle surgery. He was medically forced to, and Rowan actually studied under him, did his residency and internship with Rhodes, and took over the practice. And now he's teaching and has a new resident and intern who was there for the surgery as well. And she told me that she even went back to that original surgery, and she's like, they're both extremely detailed. I said, that's what makes them the best. Because as they were doing the surgery, he was explaining what he was doing while he was doing it, why we decided to do the surgery, his concerns with the EDS, and why we chose the donor tissue. And just, he went through and explained everything to her. And then even the funniest thing is when I noticed that stitch on the inside, even before I could ask him, he explained the reason why it was there. Which I'm like, oh, okay, well, I was just getting ready to ask you. So he preemptively knew what I was going to ask and explained it. And what it was, as they were doing the donor tissue and making sure it was tight like it needed to be, that's the reason why there was as he called it, a punch hole to hold that tendon tight as they were getting it connected and put into place. That's why there's a single stitch there. There's 2 stitches on the bottom of my heel, which has to do with the screws as well. But I came home, I've iced, was playing my Switch for a bit, and now we're heading to bed. I hope you all have a wonderful night. I'm going to post more tomorrow. Hopefully I can get to do a makeup live. We'll see. It's going to just depend on how I sleep tonight. I'm extremely exhausted. I was having spasms all night, the night before, so have a great night. Sorry it's so long. Sorry you can't see my face or my foot, but have a wonderful night, y'all, and I will talk to y'all tomorrow. Love you.